Is that something you're teaching? I know you're doing workshops now. I know you're working with practitioners to help them out. Is that something you're also kind of bestowing upon them to be more of an artist and not just know the technicality of where to make a neural therapy injection if need be?
Well, I think touch
Mm,
is the thing that I teach that's the most important piece of that in terms of becoming the artist. Um, so when I talk about the blockage hypothesis, right, I use the term hypothesis because it's not proven yet. When it's proven, it'll be the blockage theory, like the germ theory.
hmm
So there's four principles to this. One is that these lesions exist, that our scars don't heal completely. Two is that those are palpable.
mm
Three is that by connecting the dots, we reveal a whole new level of structure in the human body that medicine doesn't know about, what I call the new anatomy. And four, which is the point of all of this, is that treating these lesions stimulates the body to heal itself.
hmm
And so, you have to be a different kind of artist for different parts of the procedure. You have to be an effective communicator and you have to engage patients to get all of the information you need to know what happened to them and why. And of course, you have to be skilled and you have to use some manual artistry to be able to inject people with gentleness and keep them calm and hold the space and make the experience a healing experience.
Yeah.
But when you start using touch to work rather than using thinking to work, uh, you enter the headspace of the artist, right? Like when someone is dancing, they're not thinking about how to dance, they're in flow. And when you watch Miles Davis playing the trumpet, you know he's not thinking about what to do next. It's coming from somewhere else.
hmm
And when you start using touch, you're always engaged with the patient. You're paying attention to what's happening moment to moment. You're living in that flow. And the more time you spend in that flow, the more you evolve. Does that
And
make sense?
that makes total sense. And I truly believe as we move into this realm of AI, just pure telehealth and everything, that now more than ever, we need doctors that still embody that touch, that ability to connect and build trust and relationships with patients. And so I know, so much of what a patient wants is kind of the comfort of sitting at home and being able to, get some sort of treatment without leaving their bed. But the truth of the matter is that it requires some sacrifice to heal, I think. And it requires a true in-person exchange of energy almost to get that. And that's what you're talking about. And that touch alone is healing in many ways to a patient, and it shows care, and it shows a true humanity restored back to this art form of medicine that's become a technical aspect where we want AI to consider just what it's going to prescribe to you, it seems like. So I feel like, as people move one way, you have to look back the other, and look at that element of touch, of being there, procedures in person, building that, speaking to them and looking in their eyes and touching and seeing the reactions. That's a big part of medicine. I'm really happy that, that's something you're working in there into the workshops. And, the palpitation one was interesting because that's a development, right? You've created that isn't a set, standard in, let's say, teaching neural therapy. Where'd you come up with that as an addition, and what have you seen with that palpitation part?
Well, the palpation guided approach that I teach is something that I think is a new physical examination technique that should become a part of medicine. Uh, And, in the same way that a medical student doesn't learn to hear a heart murmur the first time they put on a stethoscope, you're not necessarily going to become very skilled at this the first time you try it. But I've come to see that most people can become comfortable with this after a 2-day workshop.
Mm.
Uh, and I developed this first by assessing scars. Because when you look at a scar, especially a long scar, you'll often see that there's a part of the scar that looks different from the rest. And, in neurotherapy, we learn to treat the whole scar. But what I came to recognize is that some parts of the scar also elicit a different feeling in my finger when I touch them. Not that they feel different to touch. They're not harder. They're not more tight. What
Mhm.
happens is that there's a little zing that you feel when you use light touch to slide over that point.
Mhm.
And that's a point that's sensitive. That's a point that's reacting to light touch when other areas of skin do not. So finding the spots that react to light touch is what I call eliciting a cutaneous stress response using light touch.
Mhm.
And what I'll often find, for example, is if I'm looking at a painful ankle, in some cases, that area is in the plantar fascia. In some cases, it's in the muscles between the toes, the interosseous muscles. In some cases, it's over an area where an ankle sprain left the ligaments traumatized. In some cases, it's the Achilles tendon. And being able to have patients pay attention to what you're doing and asking them to notice, do you feel that that area doesn't feel the same? They'll say, yeah, you're right on. That's
Mm.
exactly the point. So it's really nice because patients feel that you can feel what they feel. It gives them confidence in what you're doing. And when you inject that point in a very precise manner, targeting just that spot, and you resolve their symptoms, uh, it's a confirmation for them and for
Right.
you.
Right.
So
And
that's how that came about, starting with scars and then continuing to any patch of skin, whether it's over an old fracture, an old infection. If someone has had tonsil problems, you can usually tell which tonsil is the problem.
Mhm. And the beautiful part of that is that it's both teaching the doctor, the practitioner, and the patient. The patient has a reaffirmation. Yes, that is the spot. Yes, I know my body. Yes, right? It's
That's
almost
right.
like building the intuition that we have that we've sort of lost over time. And so
That's right.
both sides win. It's not just a doctor telling you, you go, okay, I didn't feel anything. I don't know. Let's go with it. It's getting both of you involved. So that's really wonderful.